Namaste. My name is Chandra-Mouli. I retired from the World Health Organization last August after 30 years in the organization. I continue to work on adolescent sexual and reproductive health and rights. I continue to learn, to write, to advise, to teach, and to support research, development, and action. Let me now move to the subject of this presentation, which is adolescent responsive health systems. I'm going to speak to 5 issues. Why are adolescent responsive health systems needed? What exactly are we calling for when we speak about adolescent responsive health systems? How to put them in place? What are the touch points? Where is action needed? And fifthly, what are the results likely to be as a result of investment in adolescent responsive health systems? Firstly, why are adolescent responsive health systems needed? The health of adolescents has improved over the last 10 or 15 years in some areas. It has remained unchanged in some other areas, and it has worsened in still other areas. Many individuals, including adolescents themselves, have a role to play in contributing to the health and development of adolescents. And this includes parents, teachers, neighbors, family members, and so on. Health workers have an important role to play in this context. They have a role to play in helping well adolescents stay well and helping ill and injured adolescents get back to good health. This is particularly important because many of the health problems that adolescents face are preventable and treatable. But the reality is that adolescents face barriers in obtaining the health services they need and have a right to. Some of the barriers they face are barriers that other segments in the population face. Some of them are unique to adolescents. Recognizing this, there are efforts to try to overcome these barriers and make it easier for adolescents to obtain the health services they need. There have been some benefits as a result of this, but this has been limited to some issues and some groups. In the larger sense, there are still huge barriers both to the provision and the utilization of health services. Let me move to the second point. So what are we calling for? What do we want this investment to be in? So globally, many countries are working to achieve universal health coverage in order to prevent deaths and to respond effectively and with sensitivity to injuries and illness. And they're doing this by strengthening primary healthcare systems. Within this initiative, there are growing calls to ensure that adolescents are not being left aside, that adolescents are being included. And that is what we're calling for, to deliberately make sure that we understand the needs and problems and preferences of adolescents, and we deliberately address them in efforts that are underway to strengthen health systems and make them more responsive. As I said a minute ago, there's global commitment to universal health coverage. There's global commitment to using a primary healthcare approach to achieving universal health coverage because of its inclusiveness, because of its attention to equity, and because this is the least expensive way to do this. There's regional commitment as well. So within the framework of this global and regional commitment to universal health coverage and to primary health care, there's every reason to try to ensure that adolescents also benefit from this. Let me move to my third point. So how do we put adolescent responsive health systems in place? Over the last 2 decades and more, research studies and project and program evaluations have identified the attributes of adolescent-friendly health services. We know that if we do certain things services are seen as welcoming to adolescents, and the utilization of services improve and they benefit from them. A growing number of countries are taking these proven elements of adolescent friendliness and including them in national health systems. Moving forward, the challenge is to do this work and to learn by doing, to document and to evaluate and to improve and to expand, and to share with others, both within the country and with the other countries of the region, so that this learning is not only taking place but is shared. Now, WHO's health system building blocks have traditionally included leadership and governance, financing, service delivery, health workforce, health information, and medicines and commodities. And each of these components can be made adolescent responsive. For instance, we can make leadership and governance adolescent responsive by making sure that laws and policies are in place that enable adolescents to obtain the health services they need and have a right to without restriction. Leadership and governance can also ensure that there's meaningful adolescent participation in design, in execution, and in assessment. An adolescent responsive health workforce assures that health workers are in place, they have the competencies required, they have the attitudes required to provide the right care and to do so non-judgmentally. Adolescent responsive health information systems mean that indicators that are specific to adolescents or relevant to adolescents are gathered in an age and sex disaggregated manner, analyzed and used. In addition to these 6 traditional health systems building blocks, we've included another one called partnerships, adolescent responsive partnerships, partnerships both with other systems such as education, social welfare, criminal justice, and partnerships with civil society groups, parents groups, community influentials groups, and groups led by adolescents and young people. Let me move to the 4th of my 5 points. So what are the touch points? Where is action needed to make health systems adolescent responsive? 3 points here. We need leadership and governance at the national level, but we also need it at the provincial and the district level, particularly for large countries and complex and diverse countries where the realities in the districts are very different. We need working relationships between different departments of health, for example, mental health and sexual and reproductive health, nutrition and sexual and reproductive health, and so on. We need working relationships between health and other sectors, education, social welfare, criminal justice, youth, and so on. And we need working relationships between the tertiary, the secondary, and the primary levels of care, two-way referral systems. And finally, much of the focus of health system strengthening looks at government-run health systems and health services. And that's right. Government-run health systems are large and provide services to a majority of the population. But in many parts of the world, the private sector and the charitable or voluntary sector provide services and particular types of services to important segments of the population that they need to be addressed. My 5th and last point is, so what can we expect this investment to achieve? What are the results that we are beginning to see in countries that have made these investments? Firstly, we are seeing that adolescents are in fact being included through efforts to make systems adolescent responsive. Secondly, we are seeing that there are benefits to adolescents in terms of improved quality, expanded coverage, and in terms of tangible health outputs. And finally, what we are seeing is that these efforts do not necessarily cost more than parallel systems to provide health services to adolescents. WHO is in the process of publishing a series of case studies of countries which have put in place efforts to strengthen health systems and make them responsive. Examples from countries around the world. One such example is from Chile in South America. The government of Chile identified adolescent childbearing as a priority public health issue. Over 10 years, as a result of an adolescent responsive health system approach, grounded in a multifaceted approach, information provision, education, social welfare, etc., the levels of adolescent fertility have declined by 51%. And what the government of Chile did is every single component in the health system was addressed thoughtfully and in an evidence-based manner. And together, the results are clear for all to see. Thank you and namaste.